Good afternoon, everyone, or good morning for those who are joining from India. My name is Akshay Subramanian, and I work at the Mental Health Foundation Australia and will be your host for today's Resilience and Mental Health webinar. We begin today's proceedings by acknowledging the traditional custodians and original owners of the various lands on which we meet on, and I pay my respects to their elders past and present. I also extend the same respect to any Aboriginal or Torres Strait Islander people joining us or tuning in today. Before we begin, a disclaimer that this webinar is intended for educational purposes only and should not be relied on as personal advice. Always seek the guidance of your doctor, psychologist, or other qualified health professionals regarding your physical and/or mental health. This webinar is presented in partnership with Dr. MGR Educational and Research Institute, and we thank Dr. Amudha Kumar for creating the partnership between us. This institute's vision is to provide for contemporary knowledge, delivery of global standards, excellence in knowledge creation in emerging areas, and mutually rewarding university social interaction. Their mission is to make the institution as a resource center for higher level teaching, learning processes in the fields of engineering, dental surgery, medicine, allied health sciences, humanities and sciences, architecture, and management and education. Their team wish their students to be job creators and not job seekers. On behalf of the MHFA's CEO, Mr. Vasan Srinivasan, and the founder of Dr. MGR Educational and Research Institute, Mr. Thiru A.C. Shanmugam, as well as the president, Mr. A.C.S. Arun Kumar, I would like to welcome and thank each and every one of you for attending today's webinar. I would now like to invite our presenter, Emeritus Professor Bruce Tonge, AO. Professor Tonge has a distinguished record of clinical work, teaching, and research in child psychiatry. Prior to his retirement, he was foundation head of the School of Psychology and Psychiatry and head of discipline of psychological medicine at Monash Uni. He established the internationally recognized Monash University Center for Developmental Psychiatry and Psychology. He continues to have clinical research and teaching interests in developmental psychiatry with a particular focus in the areas of autism spectrum disorders and behavioral and emotional disturbance in children and adolescents with intellectual disabilities and neurodevelopmental disorders. I would now like to welcome Professor Bruce Tonge for his presentation.
Thank you very much for the welcome. And in particular, I'm very delighted to know that we have many joining us from India, from MGR Educational, and hopefully from other tertiary institutions in that most wonderful and influential country with whom we are very proudly to be partners. Next slide. I also acknowledge country. I'm delivering this address on the traditional lands of the Jiru people, lands that were taken, not ceded. And I pay my respects to their elders, past, present, and emerging, and to any Aboriginal and Torres Strait Islanders with us today, not only in Australia, but I understand there are also some original inhabitants in the fine continent of India as well. Welcome. Next slide. I'd like to start with asking the question, what is mental health? We need to know about what is mental health in order to understand what is not mental health. Mental health is a state of well-being, referring to our emotional, our psychological, and our spiritual health. And it's about how we feel about ourselves and how we adapt and function to the best of our ability in the world around us. In other words, it's not about being dealt a good hand of cards, but being about doing the best we can with what we've got, with our potential. Mental health determines how well we work, how well we socialise, how well we love and play and be creative. And of course, all of those activities are central to being a university or a tertiary level student. It impacts our intellectual, social, and economic capital of a community. In other words, it's a vital component of our society. Next slide. So if that's mental health, what is mental illness? Mental illness are disorders of the mind and the brain that significantly interfere with our thinking, with our emotions and behaviour, with our education and work and capacity to work in the world, with our relationships and our social life and our physical health. In other words, it has biological components, psychological components, and social and environmental components. And it's essential, isn't it, to everyday being, wellness and adjustment. Next slide, please. Well, we all know that mental ill health is not a good thing. And I'm going to look particularly at mental ill health in adolescents and young adults, because I presume that that's a good part of our audience. Mental illness affects 1 in 4 young Australians aged between 16 and 24. That's quite a lot, isn't it? A third of deaths in the 15 to 24-year-olds are due to suicide. That's in Australia. But let's look at India. According to a report published in 2012, India has the highest youth suicide rate in the world. And for young people in India, it's the leading cause of death. Therefore, it has to be a most important and vital issue for the country, for both Australia and India to tackle. The age at which most young people are in education and early employment is also, unfortunately, the age of peak onset for mental illness, with mental and substance use disorders having their first onset before the age of 24 in at least 3/4 of cases. In other words, if we're going to intervene and promote mental health, we have to look at young people. It's the most common problem, the most common problems affecting the mental health of university students in Europe, in Britain, Canada, and in Australia, and in India are the following. These are the most common mental health conditions: depressive disorders, and I'm going to talk about those in more detail soon, anxiety disorders, and substance misuse. Now, just a quick thing about substance misuse, that is using drugs, illicit usually. We do know from evidence that it's more likely that people who have substance misuse problems will have started that in the context of being depressed or anxious. And so that's another reason why we should deal with anxiety and depression, because we might be able to prevent the use and misuse of substances. Psychosis, that is very serious mental illness like schizophrenia, is much less common. However, youth is the time of peak onset, and therefore early treatment for psychosis is essential, and that does definitely need mental health services. I'm not going to focus on psychosis today, although it is a very important issue. Let's look firstly, therefore, at mental health from a broad perspective. Next slide. Our adjustment or our mental health depends on how our brain functions, that's the biological bit, how we are psychologically, that's with our thinking, and the social environment and cultural context in which we live. On the biological side, there are genetic influences, there are medical influences from illnesses like neurological disorders or the use of certain drugs. There are mental illnesses like schizophrenia. And it also, biologically, our brain does control our thinking abilities and our intellectual level. From a psychological perspective, we have our personalities or our temperaments, and they're often lifelong, and they affect how we adapt and respond to stress. We have our identity formation. Who are we? What is our gender identity? How do we perceive our sexuality? How do we perceive our intelligence and our role in the world? Life events also impact on our psychology too. If we're in a very adverse and stressful environment, that will understandably impact on our psychological adjustment. Our society, our families, and our culture also impacts on how we adjust and adapt to the world. Family factors: how stable is our family of origin? How do we participate in the community? What are some of the cultural expectations we have regarding behaviour and our performance? And all of those impact on our mental health. So I want you to keep that in the background as I'm talking about mental illnesses and mental health difficulties, that there's a biological influence, there's a thinking and psychological influence, and there's also very clearly a social and environmental context and influence. Next slide, please. As well as that, given that our audience today, I think, is mostly going to be young people, we need to look at what are the developmental tasks of youths. In other words, what are the challenges that young people face, which can impact on their mental health and which they have to learn about and take into account. Firstly, there's puberty. Now, puberty occurs at different stages and occurs more early in females than males, but usually is occurring in the age bracket between, say, let's say 10 years of age and through to 16. There's a bodily change we have to adapt to. There's a whole lot of health, nutrition, and exercise proponents and impacts on puberty. All of these things are heightened in puberty. We have new emotions we've never had before, some of which might be, for example, shame and guilt, and sexual emotions, which we have to adapt to and get used to. There's huge changes in our brain too. Some people think our brains are over and done with by the time we reach puberty. In fact, that's not the case. There's probably at least 40% more brain growth and development that occurs in young people right up to 25 years of age. We're getting new computers, if you like, slotted into our brain until we're about 25 years old. And that means we can learn more differently. We can problem solve better. The speed with which we process information is sped up and faster. Our knowledge develops and becomes huge. We can reason morally and ethically and socially. We develop a whole lot of opinions about morals and ethics, about social justice, about religious views, and about our culture and about the world and its well-being, for example, climate change challenge. So it's not by chance that tertiary education occurs in later adolescence and early adult life, because that's the time, believe it or not, you've got the biggest brain power that you're ever going to have in your life. You've got the computers working perfectly. So it's a great time to learn. We develop self-esteem and self-efficacy during adolescence. Now, this is enhanced by a safe and positive social experience. That's the importance of having friends and a social world, and also by experiencing reward for achievement and effort. One of the things that universities should be about is congratulating its students on effort and on their achievements. Not necessarily on getting 100%, but at least showing that they're learning and are keen to learn. It's through those processes that we develop our self-esteem and we believe that we can do things. Social relationships and emerging sexuality and gender expression are tasks for young people. These are facilitated by a safe social and educational environment, together with family support and trust, and understanding for our emerging sexual orientation and gender identity. If we feel safe about our developing social relationships, our sexuality, and our gender expression, then that promotes mental health. It's very important to be supported by our families and by society and the world for this very important developmental process. We also become capable of future thinking. We think about the future. What am I going to do when I'm working? Where should I work? What's my occupation going to be? We make work decisions during this time. And of course, we move to independent living. These are big transitions, and again, they can be stressful and impact our mental health. So there are quite a few challenges. One of the challenges for adolescents is knowing that independently, we have to engage in a healthy lifestyle. Before adolescence, it's our parents that are telling us about this. But teenagers and young people need to develop a healthy approach to lifestyle. We need to know about the importance of exercise, not just couch potato or sitting in front of a computer. We need to understand the importance of a balanced diet. Whatever your diet is in your culture, it needs to be balanced and it needs to be a good one. We need to have regular health checks. For example, teenagers and young people should start thinking about, do I have a family doctor if one is available in your culture and society? Regular health checks begin in youth and young adult life. We need to have effective recreation and social engagement. We need to have good sleep, regular sleep. I know we have parties too, but at least 5 days a week, regular sleep. We need to have an approach towards alcohol and substance abuse. Now, I know some cultures that's prohibited, and that's a good thing in some ways. At least you don't have that challenge. But we need to have a view about using these substances, if they're in our society, safely, so we don't damage ourselves. We need to learn how to manage stress and promote our mental health. So there's a lot of tasks on the shoulders of young people. No wonder some find it stressful. Next slide, thank you. So how do we know when a young person is feeling anxious? What I'm going to talk about now is anxiety as one of those key mental health problems in young people. Anxiety can take a number of forms. It can be where we see there's distress and agitation when separated from a familiar environment. Now, some people, when they move from home to university, can be anxious for that very reason. We've moved from something that's familiar into something that's not familiar. In fact, anxiety can even develop in young people to the extent that they may start to refuse or avoid going to school or to university or to the workplace. That's called university refusal, and it's often driven by anxiety. A person who's anxious can have pervasive worry and fearfulness, not just worries about things we should be worried about, for example, like the environment, but it's pervasive, it's on our minds all the time, it intrudes and it interferes with our life. People who are anxious are often restless and they can be quite irritable, or they can be timid and shy and withdraw from society more than usual. They may develop fears or phobias or terrors of an object, like some may become suddenly very terrified of being in a public place with a lot of people. Anxiety can also be associated with events in our body. We call this somatic anxiety. So, for example, the young person may develop headaches or stomach pains or feel sick or have problems with going to the toilet. Their sleep can be disturbed. Quite often, anxious people have trouble falling asleep. They may have disturbing nightmares, and once they wake, they may have difficulties going back to sleep. Of particular importance to students is anxiety can interfere with our concentration. We can be distractible, and we can become even more disorganized than usual. Finally, people who've had a distressing experience and traumatic experiences in the past may start to relive those events relive them in repetitive activities, in repetitive and intrusive thinking, and in avoiding situations. For example, a young person may have been very upset and traumatized by being in a motor vehicle accident. And when they start going to university, memories of that accident may start crowding in to the extent that it interferes with their daily life. So in other words, anxiety can take a number of different forms. Next slide. So what is the impact of anxiety? Well, certainly it's associated with problems with our social adjustment. We may fall apart from our friends, have trouble participating in conversations, and have difficulty with learning and sporting activities. It tends to have a long-term course in youth. In other words, it doesn't easily go away, and it has very significant negative long-term outcomes, particularly with regard to educational failure, lowered vocational and workplace attainment. It can lead to social isolation and rejection, ongoing mental health problems, and is a very high cost to society in the disease burden. That's recognised by the World Health Authority, who recognises anxiety as a leading cause of disease burden internationally. Next slide. Why does it come about? Well, for a number of reasons, but there may be a number of family and psychosocial factors. For example, often anxious young people are in families where the parents are also anxious, where the parents may be overprotective and not allowing their child to become independent, and where there are separation difficulties in the past. There may be a family history in the parents of depression and anxiety. That's what agoraphobia means, a fear of being in public. There can be a number of family stresses in the past or experienced by the young person, histories of domestic violence or conflict between parents. Parents may have illnesses, chronic illnesses, and there may be even a history of child abuse. In other words, there can quite often be a family history of anxiety. The young person may also have had an experience, for example, at school of teasing or bullying, or have had difficulty with their socialization and their identity and their educational achievements and their sporting performance. All of these things contribute to distress. So there can be a number of background contributing factors to anxiety. Next slide, please. So that's very briefly thinking about anxiety. What about the other major mental health problem faced by young people of depression? How do we know a young person might be depressed? For a number of reasons. The person may experience persistent depression of mood, not just being down in the dumps 1 or 2 hours or occasionally for a good reason, but the depression of mood is persistent. The person is unhappy, and most importantly, and not often recognised, a depressed young person is often highly irritable. They find things that people say to them annoying. Often the young person loses interest in their social, recreational, sport and friendship activities. They withdraw. Some may lose energy and certainly can't concentrate, and that affects their university performance. And you can see deteriorations in their educational and work performance. Some young people may lose their appetite. That's not always the case, where some young people who are depressed actually go the other way. They may start to overeat for comfort. There can be highly disturbed sleep, particularly with waking up during the night and not being able to go back to sleep. The young person who's depressed may also suffer from poor health. And there's a very interesting one here. We know that the cause of depression in a lot of young people, particularly over the past few years, is the experience of virus infections. For example, it's associated as a symptom of the COVID virus. You also know that HIV infection can contribute very significantly to depression. And that has been identified, that work with HIV has been identified by research in India. The young person develops thoughts of worthlessness, and when they start to have those thoughts, suicidal ideas might come into their mind. Suicide attempts are very rare before the age of 10, but then they become increasing. And as I've mentioned before, they're a real problem in youth, and is it really an international crisis. People who are depressed also can have some somatic or bodily complaints, such as headache or abdominal pain. Often a depressed person can also not just have depression, but can be anxious as well. Or they might have disturbed and antisocial conduct. It's worth remembering that if a person has been delinquent or antisocial, one of the things you need to look for is, are they also depressed? Because that could be the driver. Some people who are depressed have also suffered from attention deficit hyperactivity problems as a child, or they may have had eating disorders, or they may have been using substances. Above all, people who are depressed have low self-efficacy. They have a sense that there's nothing they can do to make it better. And having self-efficacy is a hallmark of mental health in young people. Next slide. Well, why do people get depressed? It's very complicated, and I want you to think back to that very early slide of mine about biopsychosocial factors contributing to mental health. Let's look at a few of those that contribute to depression. There can quite often be a history in the family of stress. Interestingly, a number of young people who are very depressed have had a parent who died. Interestingly, it's more likely to have been a father who has died than a mother. In other words, they've experienced a parent's death or a chronic illness in the family. There's often a family history of conflict or parental separation, and poverty can play a part too. And around the world, poverty is an issue that we must pay attention to. And of course, it's a big challenge, I understand, in India as well. And that can contribute to depression. Often loneliness is a contributor. When people are depressed, they tend to withdraw, and that can make them more lonely. But what I'm talking about here is that sometimes the loneliness comes before the depression. So it's very important, for example, for universities and schools to attend to not just teaching their students mathematics or whatever it is they teach, but helping young students have a good social experience so that they develop friendships and are not lonely. Bullying can also be a factor in depression, and bullying just doesn't finish in school, does it? It can continue into university, and we know that bullying in the workplace is also a challenge for mental health in adults. We need to tackle bullying, which can be verbal or physical. And a big challenge for young people these days is the bullying that can occur on social media. That's pervasive, it's wicked, and we need to learn how to handle that. And we're looking to you young people to guide the community in how to manage this, because it's very much your world. People become depressed too if they've had repeated experiences of failure or criticism. And that's why it's important that if you're in a learning situation like a school or university, you actually receive rewards for achievement, not for necessarily getting 100%, but actually being prepared to have had a go. If we reward children and young people for having a go, for achievement, then that counteracts depression. There is a genetic element to depression, and often there can be a family history of it. And as I've mentioned also already, chronic ill health can contribute to depression, particularly post-viral infections. And I've mentioned COVID already and HIV infections as two examples of that. Next slide. Now, why should we be bothered by youth depression, apart from it being a distressing experience for the individual? Well, there are a couple of reasons why, and that is, without help and treatment, it's a relapsing and remitting condition. For instance, Children who have major depression, there's a 72% recurrence in 5 years. In other words, they'll have other episodes. Youth, young people 16 to 25 who have depression, there's a 69% recurrence in 7 years. In other words, if you were a family doctor and you saw a young person with depression, then you don't say when they're treated and are feeling better, goodbye, never see you again. You say goodbye, maybe we'll have an annual checkup, because depression can come back. Now, this is not something to despair about. If you, for example, suffer a depression and you have treatment and you get over it, you need to know that you need to look after your mental health. And if you're feeling a bit depressed again, don't be ashamed of that, but seek help early, knowing it just might be part of your nature. Severity of depression and low self-efficacy are clear predictors of relapse. Other predictors of relapse are lower socioeconomic standard, comorbid anxiety, that is anxiety as well, disappointing life events. In other words, if we face a challenge in a life event which is disappointing, that can promote depression, and a history in the family of parental depression. It's important to know about these things because we then can intervene early and do things about preventing depression from getting any worse. Next slide. So, how does the community respond to this? If you live in a community, what can the community do to help us all have a better mental health? A community can provide structure, routine, and predictability. That helps. We can limit unnecessary change. And if we know there's going to be a change, we can prepare for such changes. We can remove or modify environmental stresses that might upset people. We can tackle bullying and provide an assurance of safety. One good thing that can prevent depression and communities can do is they can provide pleasant activities. For example, universities providing pleasant activities for their student that encourages supportive social contact and matchability in interests. We can provide safe choices for people to be quiet or to be social. Most importantly, we can promote healthy diets, regular exercise, and regular sleep. We can reward achievement, and by doing that, promote self-esteem. We can also have a whole lot of mechanisms which facilitate contact with mental health services, whatever they are in your community. In Australia, for example, it's mental health services provided through general practitioners, Headspace, and other mental health services. Next slide, please. Now, what do we do if there are limited treatment services? For example, in rural and remote areas in Australia and in some countries such as India, the lack of mental health treatment services can be as high as 90%, which means that it's not easy to say, well, go and see your GP or go and see your local mental health service. And so interestingly, there's been some good work done in India that there's some evidence that programs that are community-based can promote youth mental health and well-being. And these are mainly school or university-based life skills programs which provide mental health literacy, coping skills, mental health first aid, and might be delivered by school counsellors or trained peer leaders or community support workers. There's also worldwide now a number of evidence-based online programs for the treatments of anxiety and depression. For example, in Australia, there's something called Panic Online, which is a treatment program for anxiety, or My Smiling Mind, which is a treatment program for depression. They're just two, but there are many others, and that with evidence that online programs can be helpful. So in other words, you can treat yourself by logging into an expert who's providing an online program. Next slide, please. What are the barriers to seeking health? And this is particularly pertinent to young people. Young people, and this information comes from a big survey we did, the Mental Health Foundation, of a number of young people in Australia. Young people feel that they can't seek help because they fear loss of control and they fear breaches in confidentiality. In other words, it's private and we don't want other people talking about this. We don't know whether we can trust the person we're talking to. They're worried about stigma and they're embarrassed. There are problems recognizing the symptoms. Young people may not know what anxiety is or what are the symptoms of depression, and we call that poor mental health literacy. There can be problems managing and feeling trapped by social media. This is a very important one, and it's a big challenge. There's also a very much an age-appropriate preference for self-reliant. You might remember back to the tasks of being a young person, one of them is becoming self-reliant. And if you're self-reliant, you don't want to call on help for other people, from other people. But of course, a sign of maturity is knowing when you need to call for help. And particularly for university students, there's a fear of failure or course discontinuation or even expulsion from the university, or not being allowed to practice. For example, if you're learning to be a doctor, you fear you might be barred from practice if you had a mental illness. Now, of course, that's not the case these days, but it is a real barrier for teenagers and for youth and for university students from seeking help. Next slide. So what should tertiary institutions do about this? What should your university be doing to facilitate improved educational outcomes for students with a mental health problem? Firstly, it's imperative, and you should check with your university, whether your university has a policy that supports students with a mental health problem. The institution should have a mental health policy which covers mental health promotion, mental illness prevention, and services for students with a mental illness. And that policy should be implemented in the university in a partnership with senior management, staff from different areas of the institution, student association, and representatives from outside. The institution should have a strategy for communicating its mental health policies to staff and students. Now, I have to admit that a lot of universities fail on this score. So students have to agitate to get this into the institution. Tertiary education institutions need to provide support as well for students who actually do have a mental health problem. Certainly, staff should be made aware that there's a disability officer or office which will provide assistance to students. Support services should develop a mental health promotion strategy. And support services should provide all staff and students with education on mental illness and how to respond and how to make the university a safe place for young people who are having mental health problems. Next slide. Okay, so how do we support a young person with mental health problems? How can we communicate with them? In other words, if I'm a university teacher, or if I'm a senior university student and there's a more junior university student who has a mental health problems, how can I communicate with them? Firstly, be supportive and empathetic. In other words, don't criticize them, listen, support them, and be understanding. Don't share your own problems with them. In other words, it doesn't help to say, oh yes, look, I understand when I was your age, I felt terribly depressed. And in fact, I still do a bit. Sometimes that's not helpful. We mustn't share our own problems when someone comes to us for help. That doesn't mean if we've got problems, we shouldn't seek help for ourselves. We should do that, but don't share it with someone else who approaches you with a problem. Don't be judgmental. Being critical actually aggravates the problem. Well, I'm sure you're depressed because you're not working hard enough. That's the worst thing to say. Listen rather than give advice. The best help we can give these young people when they seek help from us is just to listen. Ask the person how you can help and who else might need to know. Well, I think I can help you by modifying the assignment timetable for you. You can hand your assignment in a couple of days later And by the way, at our university, we have a student counsellor, and I think it would be helpful for you to let them know that you're not feeling well. Would you like me to help you contact them? Consider reasonable modifications to reduce workload, study stress, and compensate for any disability. For example, there are some students who have significant brain-based writing difficulties. They can't write, but they can type or they can dictate their schoolwork or university work. They should be able to compensate by using those techniques in examinations, for example. A university must have an anti-bullying, anti-discrimination policy and ensure safety for its students. We should provide information on where help is available. We should encourage and support the family and friendship group to support the young person. Now, if the young person communicates ideas of suicide with you, that must be taken seriously, and you should follow your guidelines of your university about such matters and seek help or enable the student to contact help immediately. That's why we need in a university to know what the helplines are. But remember, unless you're a mental health professional, you are not the therapist. The best you can do is to be supportive. Next slide. So there's a very brief run through on youth mental health, on the sort of mental health challenges young people in universities might face. And believe it or not, if we do some of these mental health first aid approaches, we can promote a better future in the majority of the population. So go well, eat well and appropriately, exercise regularly, have a friendship group and be social if you can. Take the opportunity to be quiet when you need to, but also be social. And all the best in your studies and your future development. Thank you.